Yeah, so I believe each presenter will have 5 minutes, and we'll have like a little grace period as well. So let us know whenever you are ready and we can start the timer.
Okay, I'm ready whenever everyone else is.
Yeah,
Okay, great. Hi, everyone. My name is Julie Conrad. I'm a fourth year medical student. I'm about to graduate in May. I'm about to start my residency in internal medicine and pediatric at UIH. And the title of my abstract is Health Literacy and Preeclampsia Knowledge in Pregnant Persons at the University of Illinois Hospital in Chicago, Illinois. Okay, here we go. So a little bit of background information. Antenatal care visits, otherwise known as prenatal care visits, that's more often the term used in the United States. These entail education surrounding different diagnoses in pregnancy and dangerous signs that pregnant folks should look out for that would prompt a visit to the emergency department. Preeclampsia is one such diagnosis that is not often fully understood in the general population, but it can indeed have significant health complications. As many of us know, preeclampsia is defined as high blood pressure and proteinuria or additional signs and symptoms in pregnant persons after 20 weeks gestation and up to 6 weeks postpartum. And preeclampsia is the leading cause of maternal morbidity and mortality worldwide. And as we are coming to understand and recognizing and trying to figure out why, underrepresented minority groups such as non-Hispanic Black persons and American Indian or Alaskan Native persons are disproportionately affected by preeclampsia, and they have a higher morbidity and mortality. And as we've known for a very long time, well-established risk factors for preeclampsia, such as obesity, hypertension, diabetes, these all disproportionately affect underrepresented minority groups as well. And health literacy is defined as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And studies have shown that a low health literacy is associated with poor health outcomes and poor use of healthcare services. So this goes to my study. I created a 40-question survey that detailed demographics, preeclampsia knowledge, and general health literacy. And pregnant persons that were at least 20 weeks gestational age were enrolled in the waiting room at the University of Illinois. And after they completed the survey, their preeclampsia knowledge was scored based on their responses to 9 different questions. And the scale was from 0 to 9, with 0 meaning no questions correct and 9 meaning every question is correct. And then their health literacy was then assessed by using the newest vital sign tool. And this is a previously validated tool to detail someone's health literacy. And it essentially asks participants to interpret an ice cream label and answer 6 different questions. And then that yields scores from 0, meaning they didn't get any question correct, to 6, meaning they got every question correct. And these were the results that we found. We enrolled 100 participants, 60% self-identified as non-Hispanic Black, 25% identified as Hispanic, 6% Asian, and 5% white. And this kind of generally reflects the catchment population of UI Health. And 52% of the folks reported high school as their highest level of education. And to the right at the top, these are the results we found. So what I found the most interesting of this whole project is that 23% of the people that we enrolled reported never having heard of preeclampsia, despite having numerous prior prenatal visits. So these are people that are at least at 20 weeks gestational age, and that's when preeclampsia can start to develop. And by then you're usually having a couple visits, and almost a quarter of the people had never heard of preeclampsia. And of the people who had heard of it, their median score was 3.5 with an interquartile range of 2 to 5. And only one person achieved the maximum score of 9. And this was an MD PhD student. Everyone else was in the lower to middle range, with that average being 3.5. And interestingly, we found that knowing someone who had preeclampsia or having a previous diagnosis of preeclampsia was significantly associated with a higher knowledge score, and the p-value was 0.0027 on that. And then for the newest vital sign results, that's what details a person's health literacy. The median newest vital sign score was 2, with an interquartile range of 1 to 5. And we found that these two weren't significantly correlated. It was a weak correlation with an R coefficient of 0.35. So some conclusions and implications of these of this study. We found that, people who had preeclampsia or knew someone who had it had better knowledge of the condition, and that's kind of reflective of maybe the education they're receiving in their prenatal care visits. Unfortunately, we need to take a better preventative approach and not wait until someone has the diagnosis in order to educate them on it, but that's what we found so far. And then also just overall knowledge of preeclampsia and overall health literacy among pregnant persons at UAH clinics is very low. And that's kind of reflective of this question up at top. We asked, how much info do you need from your provider? And in general, they acknowledged that they didn't have a lot of information and that they need, a lot or very much information. And then we also asked, what do you use for information regarding your pregnancy? And the vast majority of folks said they use the internet. So that, emphasizes the importance of having accurate and easily accessible information available online. And so overall, more research is needed to determine how to improve health literacy in our patient populations, and if this can indeed promote better health outcomes, particularly here at UIH, where we have a lot of minority populations, and they are disproportionately affected by preeclampsia. So, yeah.
Thank you, Julie.
Yeah.
I think next we have Zoe.
Okay, can you all see okay? Good morning, everyone. Zoë Harris, Chicagoland. Good morning, everyone. My name is Zoë Harris. My ancestors are from Mashpee. I'm a citizen of the Mashpee Wampanoag tribe, and I live here in Chicago. Thank you all for taking the time to attend the conference today. So to start, I just want to thank the Wampanoag Language Reformation Project. They were my community partner in this project, and they really supported this entire thing, so it would not have been possible without them. This project was intended to be an initial look at the integration of traditional health knowledge in the Wampanoag tribes, which are based on the East Coast of Massachusetts. And as a result of hundreds of years of oppression and cultural genocide, traditional knowledge left many Native communities, including the Wampanoag. And research has shown that the integration of culturally relevant health education has been able to improve health outcomes from diabetes to mental health among Indigenous people, and traditional knowledge is part of that. And on the left here, there's a picture of 4 generations of my own family, and I want that knowledge that has been passed through us to continue on. And on the right, you can see the research questions that I had. So this project used a community-based participatory research, or CBPR approach, to actively engage Wampanoag community members throughout the course of this project. The 2 parts were a children's book and then some preliminary data collection. The children's book was created as a tool that could eventually be disseminated to start the conversation around traditional health. The data collection looked at current perceptions of health status and usage of traditional health knowledge. There were case studies that were done as part of this project, and both pieces here use qualitative data, but due to the low sample size, there was no formal coding done for either component. So ultimately, there were 5 interviews that were done with community members that introduced 11 total plants that could be used in the children's book, which was named A Walk Through the Woods. And ultimately 4 plants were chosen, and the book illustrations for each of these plants can be seen in the slide here. And these plants have medicinal uses that range from pain reliever to a remedy for poison ivy. For a preliminary look at health status and traditional health knowledge, again, there were 6 case studies that were done with parents who have children at the Wampanoag Language School. And all of the parents rated their child's health as good or better. And most people, about 4 parents, rated their child's health as excellent. And even though the parents reported that their child's, or even if they reported that their child had a health concern, they still really felt that their child's health was good. In addition, what I really found interesting was that all the parents stated that they were already using some sort of traditional or spiritual medicine in their home, and usage ranged from daily to only really for ceremony. Overall, based on this assessment, there was a clear opportunity to integrate more traditional health into our community. And even though some parents didn't explicitly state that they wanted to learn more about traditional medicine, everyone was already using some sort of health knowledge, so the interest was clearly there. As it related to the health data, culturally relevant health education and materials could really improve health outcomes, but we thought it might be difficult to measure in future studies because people already think so positively about their health. And in addition, the health conditions that were mentioned could potentially be used for topics in future children's books or health education materials. Another point of interest is that parents said that they started using SAGE after the school sent it home with their child. So using the school as a conduit for additional knowledge may really be an effective way to spread this information. And it was an indication that the book really might be a practical tool to introduce this kind of knowledge into homes. I did this project as part of my master's thesis about a year ago, and since then, over 100 books have been distributed to Wampanoag families. And the wide distribution of the book and this exploratory study really show, again, the clear interest there. And even though this is really just a preliminary look in my own community, it does point to similar conclusions as past studies. So future research really might provide insight into what exactly community members are looking for, why they're using it, best ways to disseminate it, and also integrating it into our Indian Health Service. So thank you all very much.
Thank you, Zoe. And now we have Swapna.
Thank you, Tanya.
Yep.
Okay. Can we see? Okay, this is fine. Hello, thank you all for joining. I'm Swapna Dave, and myself and Ayesha Akhtar will be presenting this abstract on behalf of our co-authors. The title of this abstract is Engaging a Stakeholder Advisory Board to Address Health Disparities in the South Asian Community in Chicagoland area. Next slide, please. So just to provide a brief introduction and background, South Asians are individuals from India, Pakistan, Bangladesh, Nepal, Sri Lanka. You can see this map of South Asia on the slide here. South Asians also are 4 times more likely to develop coronary heart disease compared to other racial ethnic groups. To address these health disparities, the National Institutes of Health has funded the South Asian Healthy Lifestyle Initiative. The acronym for this is the Saheli Research Study. And this study is being conducted by Northwestern University. It's one of the first healthy lifestyle programs created specifically for the South Asian community. As part of the research study, the team has established a stakeholder advisory board comprising of about 10 South Asian community members. The board was established in 2017 and includes about 10 members even as of this year as well. The board members come from diverse backgrounds, including folks from medicine. We have a dietitian, people from, with a public health and social sciences background as well. The Stakeholder Advisory Board has worked collaboratively and developed a mission statement here, which is, to work with the communities and stakeholders to raise awareness and reduce South Asian health disparities through engagement, advocacy, and education. So the objective of this abstract here is to describe the Stakeholder Advisory Board processes to achieve the mission. Next slide. So as I mentioned, the board was established in 2017. In the first few formative years, the team kind of developed the capacity of the Stakeholder Advisory Board. And in the initial years, the board provided input to the team on the different study processes, including conducting recruitment, outreach, and that's also when they came up with the mission statement, and the goal was to implement the mission statement. So last year, we worked on developing working groups, which includes a small group of stakeholder advisory boards and some team members from Northwestern University. And we have formed 2 working groups since then. The first working group worked on creating the community health needs assessment. And the goal of the needs assessment is to identify the different health priorities for the South Asian community. This survey was a very quick survey, a 5-minute survey, which was open for about 3 months, available in multiple languages, and we had a pretty good response, which we'll be presenting soon. The second working group worked on developing a Research 101 prototype. And this came about by understanding that there's a lot of lack of awareness of what exactly research entails and how it benefits the community. So the goal of this was for the South Asian community members to come up with something which was culturally tailored, specific to the South Asian community, that speaks to the community. Here's an example of what the prototype includes. It includes an example of how research is important, and we need participation from different groups, because if there's only a certain group of people in research, the results may be misleading, and we need to include diversity in research. So these are the two different groups, and I'll now pass it on to Ayesha to present the next 2 slides.
Sure. So we were really excited with the results that we got with the working group. It was something that was also very new to the Stakeholder Advisory Board, that entire concept. And so the 90-day survey resulted in about 134 participants, and we definitely had a qualifier. You had to be 18 or older, you had to be living in the Chicago area, South Asian, etc. We found it was more female heavy, and then 64 people were born outside of the US. And some of the questions that we asked were like, where are you getting your information from? Who informs you? And so we wanted to kind of see what the landscape was, because as you saw, this was one of the first studies of its kind in the United States. And so we really wanted to see what we were dealing with. And what we found were that the top 3 health priorities that we need to address in our community are addressing mental health, diabetes, and of course, heart disease. And so what we decided that the focus would be that we will have a priority per year. So this year, we're really excited to increase the awareness on mental health and just reducing the stigma, and basically getting the community to start talking about it, knowing where to go, knowing what questions to ask. And then the second working group we had was the Research 101. And again, as Swapna mentioned, the goal of this was to talk about awareness of inclusion and making sure that the South Asian community is represented in research, and that there is value and there is need for that. And so the title was, what should you know about research? And we were focusing on just getting South Asians in the community, for example, asking them, well, how do you inform yourself on where you get your bread from, where you get your rice from? And then you can see how stores market to those communities. So we wanted to kind of draw that parallel for research, and we wanted to drive home the message of why participation matters in the South Asian community. And so the results of all of this is that we've just found that having this separate stakeholder advisory board definitely increases health outcomes. It helps to extend the mission of what's happening at Northwestern for that study. It can help to enhance the implementation and the dissemination of the research, and also kind of create accountability, because each person on the stakeholder advisory board is a stakeholder and has a greater role than simply just a board of directors. And that the working groups really had focused objectives to extend the mission, and it was really an effective model in advancing the goals overall. So we found it to be very helpful overall.
Thank you, Ayesha and Swapna. I think breakout rooms are gonna stop in about a minute. So if you want to hang tight, or you can go back to the main room.